Good morning, everyone. It's indeed a great privilege to be here. I saw the people who have stood in this in front of all of you, the 6 people before me. It's just a privilege to just follow each one of them. Each one of them have been stalwarts. I hope I can become someday like them. So it's an aspiration I have. With that, let me start my talk. My talk is in 2 portions. The first portion is about what's happening in India as a country, structurally what's happening in healthcare. The second portion is about the lessons that we have learned as an organization in the last 4 decades. Next slide, please. So we are all witnessing the transformation in India. I was talking to the people who were accompanying me today and yesterday. They said after the 1999 cyclone, this state was devastated. And what has happened in the last 15-16 years has been kind of a revelation. The state has come and a lot of thriving, the development is happening, not only in Odisha, but that is something which we are feeling across the country. There is a rapid economic transformation across the country, and we are able to sense that the per capita income has increased. Whatever your parents were earning, that's the first salary the son is getting. The last salary drawn by the father is the first salary that the son is getting. So tremendous change has happened in this country. All of us are familiar with the demographic changes. Many people, I was talking to them yesterday and today, they said because of all this IT, many people who are not from Odisha are coming into Odisha. Many of the Odisha engineers are going to Bangalore and Chennai and other cities. So there is a rapid urbanization that is happening in all over the place. And the family systems and family structures are changing. I'm sure all of you are experiencing. We are all getting into very fragmented, nuclear, small families. And people are getting older, living longer. So the society is definitely changing. And there is a rapid change in lifestyle. I saw all the malls that have come up, all the fancy 5-star hotels. And those are all, we wouldn't have imagined about 20, 30 years ago. All these are reflective of what is happening in the society that we live in. And the young people, I mean, today you see Jio giving free Wi-Fi. They said, I know how many of you know, they said that whatever was happening in Tamil Nadu with that bull fight, Jallikattu, a lot of this was happening. They said 2 people contributed to that. One was Ambani. Because of his free 4G connectivity, all these young people were able to talk to each other. Young people were able to organize themselves with WhatsApp. So you don't know where the social revolution is coming from. You don't connect Ambani's free 4G with the revolution in Tamil Nadu. And these things seem to be happening in a structured way. Next slide, please. So all these changes have made tremendous strides in healthcare. As a country, we have moved significantly forward. We should be very proud of where we are as a country. More health awareness, better educated citizens. I'm sure if you look at the literacy rate of Odisha 30 years ago and what it is today, it should be significantly very different from what it was. Higher proportion of babies born under medical supervision, decrease in life-threatening and crippling communicable diseases. You don't open a newspaper and say 100 people died because of cholera, 30 people died because of malaria. You hear some other stories that are coming up. And definitely more children are being immunized. Next slide. So the question that comes is, has this transformation touched everyone in the society? I think that's the burning platform that we all have. Unfortunately, no. China has done far better than us. If you really go back in 1989, Indian per capita was slightly higher than China's per capita. What they were able to do in the last 2.5 decades, they have gone from somewhere around $300 or $400 per capita, they have gone to about $8,000 per capita. Indians have not managed to do that. As a country, we have not been able to do that. So in the process, 1 in every 5 members, if you take India as a large family of 5 members, 1 in 5 is today still living in poverty, still earning about $1.25, something like 100, 150 rupees. Somebody earning 4,500, 5,000 rupees a month is what we are talking. So we have about close to 300 million, 400 million people in that bandwagon. So we have not done extremely well, though we may say China has a different model, they have a different kind of political system. But lifting off people from poverty, they seem to have done far better than what we have done as a country. So what are the major threats from a health standpoint to this country? This is what happens when a country grows in economic stature. As the economy becomes better, from communicable diseases you move on to non-communicable diseases. If you go back to your own grandparents or people who are older in the family, most of them, death would hit them with infection. That's what people would die. Oh, he had a cough for a few days, he died. He had a fever for a few days, he died. Today when you talk to people, they say, oh, he has cancer. He or she has a cardiac problem. He or she died because of this, that. So the whole language is changing. I was talking to your Secretary of Health, and he was saying non-communicable disease was becoming a major threat. And it is, as you can see from this slide. And we are moving towards the right. So we will probably get more and more of non-communicable diseases. The second important challenge, or whatever is going to face us, is aging in this society. We are a very young country, but we are about 8% of the population is above 60. So that is, in a 1.3 billion population, you are talking about close to 100 million people. And that's the 10th largest country in the world. If you put all the 60-year-old of India in one country, that will be the 10th largest country in the world. So it's a significant challenge. Take Japan. Japan's major problem is aging. 25% of their population is aging. Who will do the work? Who will take care of the society? Who will take care of them? Because each old person needs one or two people to support them. And that's a full-time job. So the society becomes, has to take care of itself and also take care of people who are needed, who have contributed to the society earlier. So it's a very different challenge. I don't think the world has figured out. Not only India. Nobody in the world has figured out this challenge. The other important aspect that's happening is there was a time when poverty led to illness. You know, you see these poor babies that you saw in television, Ethiopian babies and all, bones and skins, only a protruding abdomen. That was the case, say, 30, 40, 50 years ago in India as well. You don't see them now. It is not happening now. Our nutrition is far better. I think they say in the state of Tamil Nadu, there was a chief minister called M.G. Ramchandran. His one program of midday meal scheme changed the nutritional status of the state, of the people who are the younger kids. So today what is happening is illness is leading to poverty. I'll give you an example. Somebody is, say, 60. They have worked in an entry-level government position. They have retired, got a good PF gratuity of, say, 15 lakhs or 20 lakhs. Kids are educated. 10 days in intensive care unit in any hospital, they are back by 10 lakhs or 15 lakhs. All you need to do is spend 10 to 15 days. You get a stroke, you get a myocardial infarction, all your 25, 30 years of your life's earning is kind of taken back in a very, very short span of time. That's why people are talking about insurance in healthcare. People want to de-risk people who are getting health scare that is coming in the community. So this is becoming a bigger problem. In America, they said about 40% of the people above 80 can't sustain themselves. The state has to sustain them because they didn't plan. People didn't expect them to live that long. When they retired at 60, they thought their average life expectancy was 75. Today, suddenly when they live till 90, there is not enough money. They have not saved for it. They didn't even anticipate. No, they can't kill themselves. That's not a solution. So it is the government's responsibility to take care of them. So we have to be a little cognizant as providers of health for all these things. I'm sure all of you are very familiar. India spends one of the least amount of contribution from its GDP on health. 1% of GDP goes to health. Totally it's 4%. 3% is private spending. 1% is what is government spending. But even that 1%, I'll show you a slide which will tell you how different states have done very differently to make that impact. So these are the formidable challenges. I'll give you one stat. If somebody asks you, what do I do to live long? Very simple. If you do exercise, if you don't have diabetes, or if your diabetes is well controlled, if you eat healthy, if you are married, if your social connections are strong, you will live longer. If you have not done any of these things, there is only 4% chance that you will reach the age of 80. This is at 60. So if you live long, these are the 5-6 things that one has to do, unless you meet with an accident or something, which none of us can predict. And access to healthcare is definitely not satisfactory. That is true. If you go to Odisha, probably Bhubaneswar and Cuttack will be well served. But go beyond that periphery, again accessibility will be a major issue. And another important thing that is happening, which none of us are talking about, is accidents. Both young and old. Today our roads have become bigger, cars have become faster, lot of bikes. Some reason Indians don't need helmets. We are all immune to head injuries. So a lot of spinal cord injuries, lot of head injuries. So you find a young 16, 17-year-old with a spinal cord injury. Next 50, 60 years they have to live with that injury. And one spinal cord injury, one neurological injury, the whole family comes down. It is not that one individual that gets affected. The mother, the father, the grandfather, grandmother. It pulls the whole family down. So somewhere we need to pay attention to all these things. Interestingly, when one thing improves, other thing suffers. They say, why is this spinal cord injury improving or increasing in number? They say, because your ambulance system has become better. Earlier people were dying. There was not these 108 ambulances, there was nothing there. So people were left to die. But today when you're able to save them, when you're able to lift them quickly, when you're able to bring them to a hospital, then your disability lifespan becomes much more. So there is some blessings, but there is also some misgivings. I would like you to focus on this slide. If you ask me, this was a slide which was very revealing to me. This is comparing Singapore, Kerala, Tamil Nadu, Odisha. Why this comparison? 3 states are in the country, so it's kind of a random comparison. I'm from Tamil Nadu, there is a bias. Kerala is the best state in Tamil Nadu, so that's why in health statistics, and Odisha is right there. Interestingly, if you look at the per capita income, it's very interesting. The per capita income is very different. It's half of what Tamil Nadu has today in Odisha. So we are not talking about apple to apple comparison. Even though you may put the same percentage of money into health, but the absolute money that goes to your people is very different than what it goes to in a state like Tamil Nadu. The other important aspect I wanted you to reflect is what is Singapore's per capita. Singapore is 51,855. Singapore spends 3% of its GDP on health. That means Singapore spends $1,500 per individual per year. The per capita income of Odisha is not even that. But the interesting part of the story, I'm not being negative, I'm being positive. Interesting part of the story is, with that $45 or $30, look at our life expectancy. We are not very far from what Singapore is. Kerala is already 75. This life expectancy is also deceiving. If you stratify the society as lower socioeconomic strata, middle class, upper middle class, today the upper middle class and above are comparable to Singapore. They live 80. Many of you would know people in their 80s, very healthy. You look at what is happening with Mulayam Singh Yadav, people are very healthy. It is difficult, the son does not know what to do. These are things which are very real. I don't know whether you watched the SM Krishna interview. He said, I'm 84, I'm young. I would like to contribute to politics. Congress does not need me. So it's a very different society. Old people are now competing with young people. Young people are competing with old. So that's all bound to happen, I guess. Coming to the sad part, if you ask me what determines your healthcare or my health outcomes, it is not what you do. A lot of times when you're young or when you're underprivileged, it's where you're born. If you're born in Singapore, if you're a live-born baby in Singapore, if you're one of the 1,000, only 2 will die. If you are born in Odisha, 51 will die. If you are born in Tamil Nadu, 28 will die. If you are born in Kerala, 12 will die. So it's a very interesting comparison. Is there a way? A newborn, you can't blame the newborn. You can't blame the newborn saying, why were you born in Odisha? Why were you not born in Singapore? But who is owning the responsibility for this children? The voiceless people. And look at the maternal mortality. I think this is an alarming figure. These are figures from NRHM database. So I am hoping the data are all relevant and appropriate. So the maternal mortality rate, this is per lakh of deliveries. For every 100,000 deliveries, 225 young women today die in Odisha. 90 women die in Tamil Nadu. 66 women in Kerala. 3 in Singapore. So the challenge in front of all of us, more so in front of you. I'll tell you why I think the government has a bigger power. In Tamil Nadu, about 8 years ago, they bought the below poverty line insurance, RSBY-like scheme. Suddenly you find a lot of people, about 30% of the population, 35% of the population, about 2.5 crores, 3 crores of people suddenly have access to healthcare. So with one legislation, this government That's the power of government. They can reach and change the destiny of millions and millions of people. So I hope that is the message I wanted to give you. Here is an opportunity. Singapore did this in 30 years. Here is an opportunity for all of us in this country, each one, like Odisha or Tamil Nadu or any other state. We can lift millions out of where they are, and we can give them the same quality of life that they deserve. We are all human beings at the end of the day. It doesn't matter whether they are Singaporeans or whether they are Americans or whether they are an Odian, I don't know how you call them, Odishi or a Tamilian, doesn't matter. At the end of the day, people have to live a healthy life and take care of themselves. So that's the context of my presentation. I'll now share the lessons that are learned. The reason I'm sharing the lessons, I would like you to look at it this way, is how one individual was able to look at a problem. In this case, the problem of blindness. And each one of us is that one individual. Each one of us can hopefully make a difference. And when we make a difference, we can touch millions of lives. And that's the best part of where we are today, because of all the communication tools that we have, all the smartness that we have, all the knowledge that we have. It is possible to make that difference in our own lifetime in the next 15 to 20, 25 years. So coming to the Aravind story, some of the lessons that we have learned, a lot of it is rear view mirror watching. Is only looking at the organization in the last 40 years and trying to articulate what has worked in this organization. So this is blindness as a canvas. 39 million people blind. 12 million people are blind in India. India has a higher preponderance of blindness. As Indians, we get blindness a little early. This has been proved. Even if you're an Indian in America, you get cataract at least 2 decades earlier than somebody in US. Various reasons. It could be ultraviolet rays, our own nutrition, our own genetic makeup, a lot of things. But the good news is 80% of the blindness is treatable, which is a phenomenally good news. You don't have to remain blind. There is something that we can do. Obviously, cataract surgery, I'm sure many of you are very familiar. Many of your family members would have had a cataract surgery. Cataract surgery is the single surgery that is the highest number done in any part of the world. The world does about 35 million cataract surgeries a year. So it's a very, very significant number. In the American healthcare, 12% of all American healthcare spending goes towards cataract. So it's the single largest procedure. In India, we do about 6.5 million cataract surgeries a year. I think Odisha does about 1.2 lakh surgeries a year. So then the other important aspect is a pair of spectacles. So that will take care of the rest of the problem. Coming to the most important part, if you did a study, what keeps people blind? Sometimes you wonder what keeps people blind is lack of hospitals, lack of healthcare. That's not true, because Kerala's healthcare infrastructure is not comparable to Tamil Nadu's. Tamil Nadu's healthcare infrastructure is far better than Kerala, but Kerala's life expectancy is 7 years more than. So there are a lot of cultural factors in the community. So what are the cultural factors that we can play up that can help in many of these health outcomes? So the problems need not be solved by healthcare. That's the point I'm making. The problems can be solved by other measures that you do. Good sanitation, good drinking water, those kind of things. Knowledge about non-communicable diseases, that can have a significant impact. You can see, women have 36% higher chance of being blind. If you're a man, you can see this. In our hospital, we see this. A man comes at least 1 year ahead of the woman. The presenting vision of the man is at least 5 times better than the woman. The woman traditionally says, everybody in the family should be fine, I'll go the last. Till I'm able to cook, take care of my kids, I'm not going to bother my family to take me elsewhere. So that's the approach, the Indian traditional approach. And if you are illiterate, there is a 3.7 times more likely that you will remain blind. So teach people, healthcare will improve. Educate people, healthcare will improve. You don't have to put hospitals, you don't have to educate doctors, you don't have to bring nurses. Just educate them. The third thing they say is, if unemployed people are there, then they remain blind. So if you can see, it is a lot of socio-economic factors. It is not purely health factors. So it's a very, very important aspect. Economics can play a significant role in pushing this needle to the place where we want to go. Other things like affordability of care, sometimes we get very excited. I mean, if you look at the whole world, suddenly for 10 years we only talk about HIV, as if nobody is dying of any other disease. We only talk about tuberculosis. We only talk about non-communicable disease. These are pockets. In India, as I was telling you, 8% of the population is the world's 10th largest country. Even with a very small percentage, the number of people who will be afflicted will be far more. It will be a gigantic proportion. So one has to be conscious and be aware of what's afflicting us as a society. Obviously, health system designing, I think a lot of intelligence is being developed in that. The systems are getting much more robust and we are able to reach out to a larger population. They say per capita income need not be correlated to the outcome. That's what Kerala has told the world. It's very interesting. If you go around this place, society around Johns Hopkins Hospital, one of the premium hospitals in US, the health outcomes are worse than what it is in Kerala. So you can have the world's best hospital, but if you have an illiterate population, if you have a jobless population, their outcomes are not good. So kind of these factors override even health. Obviously we need technology and quality. Technology is a level playing field. It's bringing a lot of what we want to be done very quickly into the knowledge of people. So Aravind was founded in 1976. Was founded by Dr. Venkateswamy, was introduced by Mr. Balakrishnan. And the vision was to eliminate needless blindness. All the rest is same, but the only catch here is he said, I care to all. He said, doesn't matter whether they can pay or not, I need to give them good eye care. So that was the approach that our founder took. He founded this, interestingly, at the age of 58. He was a government doctor. He retired as the Dean of Madurai Medical College. So he retired at the age of 58 and then founded this organization. So in our part of the family, there is a joke, if people are worried about retiring, people expect you to do something big after you retire. So there is an opportunity, that is what Dr. V demonstrated. So this is where it started in 1976 with about 11 beds, and today we are in different locations. So on a given day, we handle about 14,000 patients, do about 1,500 surgeries. I'll give you a context. Aravind does about 420,000 surgery. Odisha state does about 1,20,000 surgery. So Aravind contributes to 8% of the country's eye care work, just to give the scale of work. And all this is one man's vision. A lot of people followed him, but one man sowed the seed. And that seed each one of us can sow today, and we can see the benefits that can reap. Dr. V passed away in the year in 2006, about 10 years ago. But the journey continues, and his inspiration keeps all of us moving forward. So I'll share the lessons up front. I'll go through each one of the lessons. So these are the lessons. You have to be unreasonable. 42 million people of Odisha, we can't be incremental in thinking. With 235 mortality rate, with 58 children, young neonates dying every year for every 1,000 live births, we can't be reasonable. We can't be calculative and incremental in our thinking. I'll grow by 5% this year, 10%. All that is not how Lee Kuan worked in Singapore. You have to leapfrog. You will have to cut across. Like how we leapfrogged into mobile phones. We didn't have landlines, we leapfrogged into mobile phones. I think this country can be a role model for the world, for all the entire world, developing world, including the developed world. We can redefine how health is delivered. So we need to be unreasonable. Draw the boundaries. I'll go through each one of this. Building collaboration, set benchmarks, relentless pursuit to execution, building the values and systems around the vision and passion. So this is what is the theme of my presentation on the lessons. See, a lot of times when you are starting your journey, all of us are very passionate. All of us are very idealistic. We have an idea. But somewhere down the line, we don't run a marathon. We run short sprints of 100 meters. We forget where we are running. We might be running around the same ground. Again and again, there is no destination for which we are running towards. A lot of reasons. Bureaucracy, our own day-to-day work, the family, multiple situations holds us down. But if you really have to make an impact, you have to be unreasonable. People should ridicule you. People should say, this is not possible. Then you're probably, you can't only say this, but you have to follow it up with a lot of action. So that is a very important aspect in what we learned from our founder. So if you really look at Aravind, these are the three building blocks that he put in place. One is the value system. I'll let Dr. V speak to you about the value system. The second was the McDonald model. See, it's very interesting when you meet people like this, what they call as level 5 leaders. They are able to connect things which don't look very obviously connected. McDonald's and eye care are not obviously connected. McDonald's and obesity are obviously connected. So you suddenly find out how this man is able to go to a McDonald's and see how can I give a better eye care by learning from them. Can I standardize the facilities that, anywhere in the world, you have all traveled extensively. If you go anywhere in the world, McDonald's is the same. They take a school dropout and pop up the burger and give it to you. So can't we do the same thing with eye care? Can't we do the same thing with healthcare? In a way, our PHCs are that model. PHCs are like miniature models of McDonald's. Same facilities, same square footage, same thing that we would want to happen. And if you have to really marry those two, a value system which says, I need to give care to everybody, and delivery system which says, you have to make it accessible, innovation is the only way forward. Can you run? I'll let Dr. V speak to you. Can you run the video?
I used to sit with the ordinary village man because I am from a village. And suddenly he turned around and then you seem to contact his inner being. You seem to be one with him. But here is a soul which has got all the simplicity of confidence. Doctor, whatever you say, I accept it. An implicit faith in you. And then you respond it. Here is an old lady who has got so much of faith in me. I must do my best for her. When we grow in spiritual consciousness, we identify ourselves with all that is in the world. So there is no exploitation. It is ourselves we are helping. It is ourselves we are healing.
So this is, it's a very, very profound statement. You are not helping someone else. It is ourselves we are helping. Somewhere one of the 5 members of our large Indian family, if they are not getting what we are all getting, somewhere it's going to hurt us. It's going to pull us. As I was saying, one child with a spinal cord injury can pull the entire family. One person in this society who is not getting it, or a group of people, will keep us down, will keep the whole energy down, the morale of the country down. So one has to be conscious of it. The other important aspect that comes from being unreasonable is you don't go with the market. You don't learn what others do. You start creating something on your own. These opportunities show up. That's how it showed up in Aravind. Because in 1980, late 80s, we were doing intraocular lens cataract surgery for the paying patient. For the free patients, we are doing the conventional surgery. You would have seen people wearing thick glasses and all that. So our founder and the founding team said, why should our poor people in India not? Because the poor people need better vision. The poor people are the carpenters. The poor people are the skilled laborers. The rich people can manage. The well-to-do people can manage. They don't need a great vision. You and I don't need a great vision. You and I need mediocre vision. 70-80% of the vision, if you can't drive, you will have a driver. So we don't need the vision. The driver needs good vision. The carpenter needs good vision. The goldsmith needs good vision. So that's the population that we need to go after. So that's how Aravind got into manufacturing. And then consultancy, that was alluded to. I'll go through each one of them. And research. So that's the point I'm saying. These are themes which are not directly connected, but these are themes which will make that leapfrogging happen. So how do you connect what is obvious with not very obvious is where miracles start happening. So today, Orolab, which is the manufacturing arm, exports its products to 150 countries. It has about 10% of the global market share. It produces a lot of orphan drugs. In healthcare, there are a lot of drugs called orphan drugs. They are not commercially viable. They are not needed in a big quantity that a big company will be able to manufacture. So those are drugs that small companies like Orolab can get in and can have a market and serve the needs of the community. And we have a consulting arm. We soon realized our mission is not Aravind Eye Hospital has to do all this. Our mission is everybody has to see. It doesn't matter whether they are in India, whether they are in Africa, whether they are in Odisha, or whether they are in Jammu and Kashmir. People have to see. That is the basic paradigm or thinking behind this vision of our founder. Then that's how we said we will share whatever we are doing. We will share whatever has been learned over the decades. So today we work with about 350 hospitals, both within and outside the country. And we also have a basic research institute. Again, a lot of our problems are very different. Probably Odisha, if you really look at the healthcare needs, they are very different because your nutritional patterns are different. Your eating habits are different. So maybe tinkering with that will save a lot of lives than tinkering with the healthcare. So, but you need research to be done to understand where those gaps are available for you to act. The other important concept I want to share is what do you do defines what you want to do. Because a lot of times we think, imagine I'm just showing you a thing, you know, this is about owning the problem. Who owns that problem of that child dying in Odisha? Who owns the problem? Somebody has to own the problem. You can't let the child die. If the child has been murdered, somebody is held responsible. The murderer is caught. But if the child dies in our state, who's held? In the country. I'm not talking about Odisha. Somebody has to take ownership. But that somebody is a level 5 leader. That somebody says, no kid should go without having. So that's owning the problem. So it also depends on where is the boundary. If you draw the boundary department-wise, this is not my problem, this is your department's problem, then you're very clear. Your boundaries are very narrow. I'll give you an example. See this whole journey. Starts from awareness, seek care, diagnosis, advice, treatment, recovery, self-care, follow. So imagine a 65-year-old individual gets a stroke. So where is healthcare coming in here? Technically, if you see healthcare, people would say it comes here. A person fell down, he had a stroke here, they lifted him to the hospital, that's where. But when did the stroke happen? Did it happen just now, here? Or it happened 25 years ago when he started eating poorly? 25 years ago when he didn't take care of his health? So, it depends on the journey or the boundary that you're drawing. If you're drawing your boundary as provider, as only hospital, then stroke is when he shows to your hospital. Then you're okay because that's your boundary, recovery. But as a state, as people like you can't draw that boundary. The boundary has to be much larger. That child in Sambalpur, if that child is not surviving, somebody is responsible. Somebody is responsible here in this state, and that's true for everywhere. I'm only sharing the thought process, how we change it, because I also understand execution is not easy. A lot of challenges, a lot of problems, but that's what makes it interesting. People have shown it around the world. So this is the theme I wanted to give you, because Dr. V constantly said, can we design for non-customers? Today, if you really look at Odisha, probably 20% of your population is getting the best of best. It's better than Singapore. I'm staying in this Mayfair Lagoon. I think Mayfair Lagoon is far better than many of the Singapore hotels. So the best of best is available in this city. The worst of worst is available in this state as well. With due respects, I'm not trying to. I belong to this country. I'm one of you. So I think we need to take pride and say we have the best. We don't have to put away the best. We don't have to behave that way. But we will also create best where the worst is. I think that's the approach that one can say or take. So in our case, community outreach programs, going into the community and surfacing the problem. People don't come. If you really look into a person who is blind, he says, who will take me to the hospital? My son can't come. My grandchildren are there. He is earning daily wages. His wife can't come. Both of them have to earn to meet the needs of the family. So you create a mechanism. In fact, we did a study, interestingly, when we went to a community and said, you have a cataract, you need surgery, we'll give it free. And here is 100 rupees for you to come. 20% of the people came. You provided transportation and said nobody need to bring you. 95% of the people came. So everybody wants vision. Everybody is smart. You are rural, uneducated, they all know that vision is important. All of us are smart enough for that. But to get there, they need support. It's not that you open a fancy hospital in one of the large cities. That doesn't mean that the problem is solved. That's a very myopic view. You are drawing the boundary very narrowly of where you fit healthcare. And we also realized screening camps or eye camps are not the solution for every problem. We started something called as a vision center, which is I think it's a very pioneering concept. You can saturate eye care in a community. We don't saturate eye care. If you really go and talk to a guy who sells Bajaj bikes or a Hero bike or a Honda bike, they saturate a market. They say this is the age group of 18-year-old to 30-year-old. This is the number of people in the society. Only 20% of them are buying bikes today. How do I make 60% of them buy bikes? So they study the market far better than we study the market in healthcare. So is there a way that we can do? And it's possible in this country. 10 years ago, we had about 50 million mobile phones. 10 years down the line, we have 900 million mobile phone. How did that distribution happen? How did that penetration happen? How did all the linkages happen? How did the towers got put up? So this country, it is possible. Phenomenally possible. I don't think any other country in the world, apart from 1 or 2 countries, have demonstrated that possibility. And I think we can be a role model or torch bearers in health as well. So this is a vision center, one of the models. I'm not going into the details of it. I'll skip this video. So if you really look at it, this again comes from the boundary theme. Existing demand is usually small. What we serve is usually small. I'll give you a cataract example. This state does about 1.2 lakh cataract surgery. You need to do 3.5 or 3.6 lakh cataract surgery to reach where Gujarat is, where Tamil Nadu is, where Andhra is. I'm not talking about to reach Singapore or America. So that's an opportunity that is available. You'll suddenly see a lot of young ophthalmologists becoming entrepreneurs. A lot of people doing extremely well. But the government infrastructure will change. I'll give you another example in Tamil Nadu. Tamil Nadu, all the private practitioners, all the obstetricians are crying foul. Because in Tamil Nadu, there was a time in 70s, they say 60% of the births were happening in the government sector. And in the 90s and 2000, early 2000, 85% of the deliveries were happening in the private sector. Very small portion happened in the government sector. Suddenly you see today, we are back to that 65% happening in the government sector. Because for every delivery, the government gives you 12,000 rupees. The government has upgraded your infrastructure. Every PHC, upgraded PHC can be a center where delivery can be conducted. Caesareans can be done. The state program monitors it. So suddenly with one legislation and one approach, people have changed. So the neonatal mortality rate has become much better. So those are some of the practices that have shifted the needle in some of these conditions. So one way to look at this is, how do you go after unmet need and also undiagnosed need? That small child's voice, if we can start hearing, that's the undiagnosed need. If we can amplify it and do something, then we are able to achieve something significant. Nothing can be done alone. We all realize that. I think that's the reason why you've been very gracious in inviting people like me here. We all work together. We are all part of the solution. We are not the private, public, all that is our own divisions. But for a patient out there, doesn't matter. If you give solution, all of us are part of the solution. So today we work very closely with many organizations. India as a country has to be really proud of what we have accomplished in eye care. Forget Aravind. Aravind is one of the players. But as a country, we have done significantly well. We are at par with many of the developed countries in terms of cataract penetration in this society. So that has happened because some people sow the seeds. And I tell you, there are 3-4 people who are doyens in ophthalmology in the country. And the central leadership of this country, health minister, health secretary, were very proactive. India in 1996 took a loan of $135 million from World Bank. They say that's the best loan World Bank has ever given in the world. Because the impact of it, because in 1995 India was doing 1 million cataract surgeries. Today we are doing about 6.5 million cataract surgeries. Look at how many people see their world better. They say that's the maximum return that any investment that is given to a World Bank investment. So that's possible. It's been demonstrated in our own country in one small field. The other important aspect is, how do we benchmark? I think a lot of times when we are from India, we kind of aim low. We don't aim big. That's why I think when movies like Dangal and others come and show what can be done from a rural area, we all feel for it. We are all emotionally connected. We want to do well, but unfortunately our aspirations can be very reasonable, can deceivingly be very reasonable. We'll have to push ourselves into thinking in a breakthrough way. So I'll give you some comparison. So today, number of eye surgeries done by United Kingdom. United Kingdom, why United Kingdom? 70 million population. Tamil Nadu, 70 million population. United Kingdom has the best health records in the world, because 90% of their healthcare is done by National Health, NHS, which is their healthcare providing organization. And their cost of providing eye care is 1.6 billion pounds. At Aravind, we probably are little more than 15 or 16 million pounds. There is 100-time differential. You can leverage it. This is nothing smart. We need to do this because your per capita income is low. But you can do dramatically different things because your scale is much more. Imagine we are a country, we are doing 60 lakh cataract surgeries. You have 20 companies that are probably 200, 300 crore companies in this country, which are supporting eye care. So you will start getting a lot of employment around healthcare. It is not only you're solving someone's problem, but you're also providing solution to a lot of other things when you're solving a bigger problem like that. And other important things is today I think in India we realize we have a responsibility towards the larger world. I think people can't copy America. America is a failed model in healthcare. Not only America, Europe is a failed model in healthcare. If we follow them, which we are doing, we are doomed. Because they don't know what to do. American elections are fought with, what did President Trump do? Came back and removed the Obama healthcare. So healthcare is a very, very contentious topic, very, very timely topic. So we need to create our own model. If we can create and do it well, we can be role models in this world. We can show the world how things have been done. We have shown it. 500, 600 years ago, this country was leading the world. Our culture, our literacy, our literature, our art forms, I don't think anywhere in the world you see. In fact, you go to America, you feel very shallow. They say it's a very historical monument which is 200 years old. And anywhere you will have a house in Odisha which is 200 years old. You will have temples which are 500,000 years old. So it's a very different country that we are living in. I think we need to go back and get back the same glory as we are used to. Another important aspect in benchmarking is sometimes we get lost in numbers. How do we give dignity to people? In all this, I think this is something which is going to be a defining moment. If we can do this in a dignified way, if we don't make this individual who is earning less than $1 or 100 rupees a day, don't demean that individual to get their care. If they can get dignity and get the care. In the insurance system that came in Tamil Nadu, I was saying, suddenly people became consumers. See, if you're free, you're not a consumer. Because he says, I'm not paying, but the government is paying. You're getting the money from somebody, so you better treat me like a consumer. You better treat me well. If you're not treating me well, I'll go to the government. And the government has the muscle today. Because every private hospital is competing with the government for that insurance contract. The government says if you don't meet all these 10 points, you are not going to be part of this panel. So some of this is like...
focus will be on surgical steps.
Volume kam karna chahiye. Yeah. So this is about, in a country like India, we have about 15,000 eye doctors for a population of 1.3 billion. We need to amplify our resources. So that's one example. One surgeon with 2 surgical tables can do about 6 to 8 surgeries. So I'll give you one benchmark which will help you to see this. So in Aravind, an average surgeon, we expect that average surgeon's productivity to be about 1,500 surgeries. Looks like a big number, but it's not a very big number. You break it into 50 weeks, twice as somebody is operating, it comes to about 10-15 surgeries per turn. Not a big number, but to get there, you need a lot of logistics support. If you ask me what Aravind is good at, not eye care. Aravind is good at logistics. Because we made a comparison. We are setting up a hospital in Tirupati. We were talking to the Tirupati executive officer. Tirupati executive officer was talking to us and he said 65,000 people on an average come to Tirumala. And 65,000 people have only one aspiration, have to see the God. There is no other. In eye hospital, at least you have 20 doctors. You don't have to see only one God. So Tirumala, Tirupati, as they said, we are creating parks, we are creating restaurants, we are creating a lot of distractions because we want people to spend time before they come and see the God. We want people to spend, because if they all come to the God at the same time, it's going to be a stampede. So they are investing very strategically to break that. And they have all this barcode, they give you the time and everything. Today, Aravind sees close to 20,000 people every day. We perform 1,500 surgeries. So we need to think that way. We can take advantage. So we feed every day about 4,000 meals. Every day, because that's the number of people. 1,500 people operate, 1,500 people post-operative, 3,000 people are staying here. We need to feed them. So that's the logistics that we need to be good at. Eye care is incidentally we give vision. But our major work is logistics. And young women in this society, I'm sure they are available in Odisha in plenty. Young women, when we started this, the young men find a way. They do something, they do a job here and there. Young women when they're 18 to 20, 22 have been a very productive resource in a state like Tamil Nadu. I'm sure in Odisha, I don't know the reality here. Textile mills, hospitals, malls, all of them are going after them. They give them accommodation. They really take care of them. The parents would come and trust them, because it's difficult to keep a 18-year-old girl at home. If they can be productive, if they can earn for their own wedding, that brings down the burden of the whole family, makes the family more productive. So, see, all these factors have contributed. I just wanted to share with you, it is not one element, it is multiple small things that have kind of contributed in building an organization or institution. The other important aspect is execution, which I alluded to. Execution is very different. All of us it's easy to share an idea, it is easy to share an aspiration, but following through, it's easy to, every one of us can start a marathon. All of us can start a marathon. You don't need to be very good in starting a marathon. How many of us can end a marathon? That's where the critical point comes. Ending a marathon is more important than starting a marathon. So I think in all this, one has to be very realistic too. And you can't be very utopian in your view, and I'm going to change everything overnight and tomorrow. But our aspirations can be higher, so that our ideas are better. I'll give you an idea. In Madurai, where I am from, a typical patient that comes to the organization has about 15 interactions in a given day, if you are coming for a spectacles or a cataract or whatever. So this is the number of interactions that we have every day, 49,500 interactions every day. Each of these interactions should go well for the patient to see well. If even one of these interactions doesn't go well, you can't say I had a bad day. Your bad day can hurt 100 people not seeing well that day. So how do you build systems? How do you build robustness in what you do? In being able to consistently give. People have done this. Industries have done this. Six Sigma. Every 1 in a million piece will fail is what is Six Sigma. Have we achieved it in healthcare? Unfortunately, no. In fact, I was reading somewhere, people are worried when a plane crashes, right? We are all worried. We open the newspaper, breaking news comes. They say every year 10 jumbo jets of people die because of healthcare errors. Healthcare errors. Imagine how many, I'll give you one scenario which I'm probably going to share. Today I'll describe an 80-year-old man. 80-year-old man is wearing a hearing aid. 80-year-old man has a denture. Both eyes cataract done. Gallbladder surgery has been done. Both knees have been replaced. Has diabetes for 30 years. Has hypertension kicked in. This is the status of people. Healthcare is after cure. Today we need to think of healthcare as care. That's another topic. But I just want to say, a lot of intricacies are involved in executing this perfectly so that the end result can't be an accident. End result has to be programmed. So the lesson 6 is organization's DNA. I think it's a very important element. I can look back and say, without Dr. V, this wouldn't have been possible. Without his inspiration, without his guiding, without his pushing us, coaxing us, sometimes reluctantly following him, all that made the organization where it is today. When you're small, culture drives you. In your family, you don't have systems. You don't put a roster in your family. You don't put an attendance system in your family. That's culture drives all that is happening in a small organization, small family. As you get larger, I don't know whether you have biometry, all that starts coming in when you become a larger organization. People start measuring you, are you coming on time? So the balance is, in what we have understood is, how do you balance culture and systems? You can't become completely system-centric, you can't be completely dependent on culture. Temples have done it phenomenally well. Every 12 years, the temples have a Kumbhabhishekam. You look at the temple's timings are better than a lot of our own working time. The gods close the doors for lunch. The gods have a siesta in the afternoon. So it's very interesting. People have thought through all those things. People who work in temple need rest. People need time to take care of it. So as a society, we have a lot of intricate things in our society, and leadership cannot be stressed. So, like you take Indian cricket team, always a losing team. Suddenly one captain comes and we start winning. The same 11 players starts winning. Where we suddenly start wondering what is happening. The same 11 guys didn't play, were like losers, their shoulders were drooping. Suddenly you find them playing against Australia doing well, playing against England doing well. So there's one or two people who are inspirational, who can make that change. That catalytic change can boomerang and make a significant contribution. So I've shared a lot of these things. It's nothing special, but it is very important. Focus on the right things. Doing it right every day, day in and day out is not easy. Your mother has done it. Your mother has put food on your plate, day in and day out, for 35 years, 40 years, 50 years. I'm sure your wife does it today, or some of you are doing it to your spouse. That's not easy. To do it every day consistently, to bring up a child is not easy. It is how many days? 365 days, till about 20 years. Every day you feed that individual. You bring them up with all their love. It's not the ingredients that make the food. Your mother's food is not ingredients. Your mother's food is a lot of love, a lot of affection, everything that is all boiled together. So this is what Aravind has done. Give away a lot of it free, charge market rates for those who can help. We are helped by market inefficiency and also at the mindset. So I don't want you to go with the message that Aravind is this organization that has a lot of it free, altruistic, charitable. It is. But please remember, there is a tremendous business sense in being altruistic. There is a tremendous acumen. People are smart. Reliance Jio is not altruistic and charitable when they give you free 4G. They are smart. They are getting you. Facebook is not altruistic in giving you free connections. Google is not altruistic in giving you a free Gmail. It is free to you with a package. So the point I'm making is, you can leverage if you have the volume. So what do we do in free? Tremendous community acceptance. Why am I standing here? Imagine if I was a very successful private practitioner, will you call me? Mr. Bakshi will not be even touching me with a 20-foot pole. Because of what we are doing to the community, acceptance of the community, economies of scale, you can get advantage. Unless you go to that level of population, you don't get the scale. You build efficiency. You start thinking frugally. You start thinking, can I do cataract surgery with 500 rupees? Then comes manufacturing. Then comes a lot of innovation that follows. So don't look at free as something which is negative, which you are giving to somebody. It is going to give back to you significantly. In fact, if you really ask me this slide, it should not be 50-50. It should be 70 or 80 here and 20 there. Paying is incidentally, when you pay, you're very flaky. Very interesting. When you're a paying patient, you're also more concerned about what people think of you. We are all, in a 5-star hotel, we behave well. We don't behave badly because we are all worried about what others will think of us. So it's easy to take care of the paying patient than the free patient. So I'll recap this, and I'm coming to the last slide of my presentation. I've taken a little more time than needed. So these are the lessons I would like you to reflect upon. How do you be unreasonable? And today in our society, this day and age, it's possible and we should do. If you are not, that is unreasonable. We have to be unreasonable. I think that is the reasonable thing to do. Draw the boundaries appropriately. We have to have ownership to the problem. We are responsible. Once we feel that, somewhere the solutions will come. The dots will get connected. Don't worry. I've seen it in my uncle's life. I'm seeing it today. I'm coming and standing in front of you. I knew only Mr. Bakshi about 5 years ago. How did this dot get connected? And if you go back, I've heard Mr. Bakshi say his mother was blind for a long time. See those connections that are happening. You can't predict, you can't manufacture those connections. It has to happen. It will happen when the common goals are aligned, when the common aspirations are aligned. These connections get made. It's spiritual. It's somehow this miracle start happening. Set benchmarks. I think we should lead the world. Here is one area in healthcare we can show the world what we are as a country. And relentless pursuit to execution. Toyota has shown us. Toyota's production system is influencing the worldwide production. Can't we show it in healthcare in India? We can become the model in healthcare which others can emulate and build the values and systems. I think in our country, people don't have to talk about values. There is enough values ingrained in our society. We can learn from them. So finally, I would like to leave with this quote of Dr. V. Intelligence and capabilities are not enough. There must be a joy of doing something beautiful. Trust me, in this room, there is enough and more intelligence and capability. If you need more, all we have to do is open Google and search for it. But what we really need is the joy of doing something beautiful. Thank you.